Good morning, ladies and gentlemen. All protocols being observed, thank you for the opportunity to present. And my topic today is depression and diabetes mellitus, a primary care perspective. So why this topic? Well, it has been reported that the one-year prevalence of major depression in a primary care clinic was 10.4%. However, only 15% of these cases were diagnosed by primary care physicians. So this is a major public health challenge because there is the underdiagnosis of depression. And as you may know, depression negatively affects glycemic control in diabetics. So, what is the scope of this problem and how, as we as public health practitioners, can begin to address it? The objectives of this presentation is to briefly overview the prevalence of depression and diabetes, to look at the causal pathway between depression and diabetes and its bidirectional association, touching on screening and my recommendations. So, in the world, how many adults have diabetes? 415 million. And by 2014, this number will rise to 1 in 10, 642 million. An alarming 46.5% of adults with diabetes are undiagnosed. And 12% of the global health expenditure is spent on diabetes. In addition, 3/4 of people with diabetes live in low and middle income countries. And every 6 seconds, a person dies from diabetes complications. So it is a very important disease and important to talk about this morning. And what about in the North American and Caribbean region? Well, 1 in 8 adults in the Caribbean and North American region has diabetes mellitus. And according to the International Diabetes Federation, we have the highest prevalence of diabetes compared to all the other regions in the world, with an alarming 12.9% of the adult population being affected. Moving on to Trinidad and Tobago. In 2015, according to the International Diabetes Federation, there were 1,300 cases of diabetes in Trinidad and Tobago. And the prevalence in adults aged 20 to 79 was 14.5%. And out of those who were undiagnosed per 1,000 population, it was 39.4. And the number of deaths per year due to diabetes complication was 1,593.7. Moving on to depression, which you all are very, very familiar. Depression is estimated to affect 350 million people worldwide. And according to the World Mental Health Survey conducted in 17 countries, an average of 1 in 20 people reported having an episode of depression in the previous year. This is according to World Health Organization 2012. Again, highlighting the importance of discussing this topic. What about in Trinidad and Tobago? According to a community sample, we have a prevalence of 14% of depression in Trinidad and Tobago. So now, this presentation is on the prevalence of depression in diabetes mellitus. So what does the literature say? According to a meta-analysis of 42 published studies, the prevalence of major depression in people with diabetes was 11%. So that is alarming. Okay? And this depression in diabetes in the world varied by diabetes type and according to if it was in the developed versus undeveloped countries. type 1 diabetics, the prevalence was 12%, and the prevalence was higher in those with type 2 diabetics. So in control studies, the odds of depression in the diabetic group were twice that of the non-diabetic comparison group and did not differ by sex, type of diabetes, subject source, or assessment method. And the confidence interval was significant, right? So 2 times as many patients with depression are diagnosed from the diabetic groups as opposed to the non-diabetic groups. And for the women, yes, it is higher in the diabetic women, depression, versus diabetic men, 18%. And it was found by these studies that self-reported questionnaires were done more, 31%, versus standardized diagnostic interviews. Back to Trinidad and Tobago. What is the prevalence of depression in our diabetic patients? Does anybody know? All right. So the prevalence of depression was 17.9%, sorry about that, 17.9% in type 2 diabetic patients reported mild to moderate levels of depression. And this was done in 4 major hospitals in Trinidad. So moving on, what is the nature between diabetes and depression? Well, depression is associated with diabetes mellitus. However, the direction is not clear. Depression may be a consequence of diabetes or a risk factor for the onset of diabetes. The prevalence of clinical depression and the presence of elevated depressive symptoms are higher among persons with diabetes compared with those in the general population. These associations may be related to the risk of depressive symptoms in individuals with diabetes, increased risk of type 2 diabetes in individuals with depressive symptoms, or both. So, you see the depressed person and what if depression causes diabetes. So the first hypothesis is the increased risk of type 2 diabetes in individuals with depression may result from the increase in counter-regulatory hormone release and action, alterations in glucose transport function, and an increased immunoinflammatory activation. These all contribute to insulin resistance and beta islet cell dysfunction, which lead to type 2 diabetes. Several longitudinal studies reported that elevated depressed symptoms are associated with incident type 2 diabetes. And the factors associated with depressive symptoms include obesity and its physical inactivity, hypercaloric diets, the activation of neuroendocrine and inflammatory responses like cortisol, catecholamines, and cytokines. And these induce insulin resistance and the development of type 2 diabetes. Now moving on to if the diabetes causes depression. Depression in people with both type 1 and type 2 diabetes results from chronic psychosocial stressors of having... Finish? Oh, okay. So...
Sorry,
no. Sorry. So, depression in people with both type 1 and type 2 diabetes results from chronic psychosocial stressors of having a chronic medical condition. Okay, so now I'm going to talk about the bidirectional association. And, and there was a study published in JAMA 2008, a cohort study done on examining a bidirectional association between depressive symptoms and diabetes. The cohort was on a study population of 6,814 men and women aged 45 to 84 years and were followed over those periods. The scoring was done by the Center for Epidemiologic Studies, Depression, score of 16 or higher, use of antidepressant medications or both. patients were categorized as normal fasting glucose, impaired fasting glucose, type 2 diabetes, and receiving diabetic treatment. Just looking at the baseline characteristics of the two groups, those with the depressive symptoms and the incident diabetes, compared with participants without elevated depressive symptoms, those with depressive symptoms were more likely to be younger, female, less educated, lower annual income, smoked cigarettes, had a high caloric intake, and less likely to consume alcohol. And in the depressive symptoms and incident diabetes, the elevated depressive symptoms were more common among Hispanic, less common among Chinese American, African American, varied by site. They had lower systolic blood pressure, higher BMI, higher HDL, higher interleukin-6, and higher CRP than those without depressive symptoms. Now looking at the results of the depressive symptoms and the incident diabetic group. The incidence of type 2 diabetes over the 3.2 years that the study was done was 22 per 1,000 person years for those with elevated depressive symptoms, and 16.6 per 1,000 person years for those without elevated depressive symptoms. And it was a significant confidence interval. So, did I miss something? Right, so for the diabetes status and incident depressive diabetes, compared with normal participants, those with impaired fasting glucose and type 2 diabetes were more likely to be older, male, non-white, less physically active, and had a higher BMI. And those participants with untreated and treated type 2 diabetes had lower educational attainment, lower annual income, microalbuminuria, hypertension, lower HDL, and higher triglycerides. And those with treated type 2 diabetes were least likely to consume alcohol and had the lowest daily caloric intake. Looking at the results, the incidence rate of elevated depressive symptoms over 3.1 years were 36.8 for participants with normal fasting glucose, 27.9 for those with impaired fasting glucose, 31.2 for untreated type 2 diabetes, and 61.9, the biggest amount, for treated type 2 diabetes per 1,000 person years. So there you see the incidence rate of elevated depressive symptoms was highest for the treated type 2 diabetes group. So compared with participants with normal fasting glucose, the odds of developing depressive symptoms were 20% lower in participants with impaired fasting glucose. And most importantly for us, treated type 2 diabetes was associated with a 52% higher odds of developing elevated depressive symptoms, with again a significant confidence interval. Conclusion. So in this study, published in JAMA 2008 by Golden et al., there was a modest association of baseline depressive symptoms with incident type 2 diabetes. And impaired fasting glucose and untreated type 2 diabetes were inversely associated with incident depressive symptoms. Treated type 2 diabetes showed a positive association with depressive symptoms, and the association was not affected by adjustment, confounded, or mediating factors. So, looking at screening. Now, according to the CHRC guideline on managing depression in primary care in the Caribbean, it is important that early recognition and treatment of depression is done because it improves long-term outcome. Right? Now, there are a range of screening tools available: Beck's, Hamilton, Montgomery, Asperg, Zong, CGCAPS, and the Patient Health Questionnaire. Right? So you can just choose any one of these screening tools and implement it in your practice. Well, for the public health practitioner. Also, the image gap intervention guide, which was developed by the World Health Organization, it is a tool to screen for depression in the community, and we as public health practitioners could implement this in our practice. According to the literature research, the most popular screening tools used in diabetic populations are the Beck Depression Inventory, 24% of studies shows that, and the Center for Epidemiologic Studies. Right? And according to the CHRC guideline, the patient health questionnaire, two simple questions can be asked as a quick screening. Do you feel sad or down, or do you still enjoy the things that you usually do? So my recommendations are to use the guideline by the CHRC in the management of depression in primary care, and to implement an effective screening tool yearly for all diabetic patients. Because as you can see, we have a high prevalence of depression in diabetics, and you saw the positive association with treated type 2 diabetes. And I also would like that we get funding and start to investigate the prevalence of depression in diabetes in our patient population. Thank you very much.